As you know, either the CVS or the amnio carry some risk to the baby. Now, the advantage of the CVS is that we can do it earlier, but the risk of loss of the pregnancy is about 1 in 100. Now, with an amnio, we'll have to wait till about the 14th to the 18th week, but the risk of loss is lower, say 1 in 200 or less. Now, I know how much this baby means to the both of you. One factor in deciding whether or not you want to have either of these tests is whether you would do anything with the results. If you know that you're going to keep this baby no matter what, you may not want to take even a small risk of losing the pregnancy. On the other hand, if you're ambivalent about continuing this pregnancy if the baby has Down syndrome, the results of the test may be more important for you to know.
The thing is, doctor, my husband and I have discussed this, and we're not sure what we'd do if this baby has Down syndrome. We want this child so bad, but at our ages, we're not sure if we're up to the challenge of raising a handicapped child. Are both of these tests equally accurate? And can you tell me a little bit more about what they involve?
Yes, they both will definitely confirm whether or not your baby has Down syndrome, but there are differences in when we could take them and the degree of risk involved in each. Let me explain each of them to you.
Now I want to make sure these tests are safe for my wife before we consent.
I completely understand, Mr. Abbott. Mrs. Abbott, at this point in your pregnancy, I can offer you a CVS test. Now, this involves testing a small amount of chorionic tissue from your placenta. The CVS test can be accomplished by two methods, transcervically or transabdominally. The transcervical CVS is typically performed between 10 and 12 weeks of your pregnancy. It's just like having a pap smear. After the cervix and vagina are cleansed, a small catheter is inserted with an ultrasound guidance into your placenta. A portion of the placenta is biopsied and sent to the laboratory for evaluation. Now, if we want to do a transcervical CVS, we need to do it this week since you're already nearly at 12 weeks. We can also do a CVS abdominally, and this procedure can be done later than 12 weeks. After we clean your abdomen, we insert a needle under ultrasound guidance into your placenta to collect a biopsy. Now, the transabdominal CVS may result in a moderate degree of discomfort for you, whereas the cervical CVS generally does not. With either of these procedures, there's a procedure-related risk of approximately 0.5% to 1% of causing a pregnancy loss. However, for the mother, there's very little risk in either procedure.
Would we be better off in waiting to have the amnio? We've been discussing whether or not to have the amnio if the screening tests were positive.
We'd have to wait a little later in Mrs. Abbott's pregnancy to do an amnio. Typically, those are done between the 14th and 18th week. The good thing about an amnio is that it's safer. The risk to the baby is only about 1 in 200 or less. With an amnio, we clean off the abdomen, and again, using ultrasound guidance, we insert a needle into the amniotic fluid surrounding the baby. Now, tentative results for the presence of Down syndrome can be available in a day or two using special techniques, but typically it takes approximately 12 to 14 days to obtain absolute results. An advantage of amniocentesis is that there's less risk to the baby than with CVS, but you won't know until later in the pregnancy should we wait to do the amnio.
I'm really concerned about both of these procedures and about harming the baby. I'm just not sure what to do.